The first thing you'd like to do when you walk into a patient's room is perform hand hygiene. I then would introduce myself as Carly Nichols, the nurse, and I would want to have the two patient identifiers, one being their first and last name, and second being their date of birth. I can use their wristband to confirm this and ensure that it's the right patient. I then want to introduce what I'm going to be doing, and that would be the head to toe assessment, where I can assess the patient's vitals, skin integrity, listen to their lungs and their heart, test for strength and gait and mobility, where I can then document this and I can plan goals and outcomes for the patient for their visit at the hospital. It would be important for me to ask the patient if they have any allergies and those reactions that they've had to those allergies, so we can have it documented and ensure that this issue does not occur while they are in the hospital. I would also want to orient the patient of our pain scale. When you have a 0 pain, it would be a 0, and then the most pain possible would be 10. I would want them to explain to me what their pain is from the 0 to 10 scale, where it is, and how long they've had that pain. One of the things I'd like to do to start off with is just inspect with my eyes before even having to touch the patient. You can look at the patient, take a look at their skin, their personal hygiene. Are they well kept? Are they able to form facial expressions? Do they look their age? Do they look distraught? Do they have any issues forming emotions and talking with you? And this is a lot of things that you can just do by just inspecting and looking at your patient. The next thing I'd like to do is take a look at the patient's balance. I'd have them stand, shut their eyes. Are they able to stand okay on their own? Do they have good posture? I'd want to see them take a few steps. Are they able to walk without assistance? Do they have a normal gait? Do they have any weakness on either side that's making them a little unstable? I then would want to assess their alert and orientation. I would need to know ask them questions to refer them to place, person, time, and situation. And by doing so, I can ask their name again, if they knew what year it was, if they knew where they were. They can tell me the color of the grass outside and why they were in the hospital. If they were able to answer those questions, I can then determine the patient is A&O times 4, and that would be a normal finding of learn orientation status. The next thing I'd like to do is take a look at the patient's skin and nails. I'd like to test for skin turgor by pulling on the skin and seeing its retraction with elasticity. Does the skin just go back, or is it slow to return to its normal space? Is there any edema, pitting edema when pressing down on the patient's arms, and looking at their legs as well and their calves? You would want to test for temperature, and you would want to keep looking for any lesions, bumps, bruises, any scabs, any primary lesions that would form, which would be the bumps, the bruises, the scabs, any secondary lesions that would form from those, that would be a bed ulcer, or anything that's been left unnoticed and has gone on for quite some time. You would want to test for capillary refill by pressing on the nail bed and testing to see how long that refill is, that color to return. 2 seconds, within 2 seconds would be the perfect and normal finding. The next thing I'd like to do is take a look at the head and the neck. I would want to test the normal movement of the head and the neck by having the patient move their chin down, point their face to the sky, take their chin to their left shoulder and point it down, come back neutral, and do the same thing on the opposite side. While doing so, I want to inspect their face and their eyes and their nose and their ears. Are they symmetrical? Is there any drooping that I can see? Are their eyes symmetrical? Are their ears symmetrical within normal limits of each other? I would want to inspect the scalp. I would want to look for bumps, bruises, any scrapes, any patches of missing hair, any bed ulcers. It'd be important to take a look at the back of the head. A lot of non-ambulatory patients can form bed ulcers from laying down for too long and no movement. You would want to take a look there, look for any infestation, lice that they may have in their scalp. A normal finding would be no missing hair and no tenderness, no bumps and hard spots or soft spots in the scalp. I then would want to take a look at the patient's eyes. You want to look for redness, any dryness, any discharge, any droopiness. Are they able to open their eyes with ease, move their eyebrows, any issue with their eyelids. I would want to test their pupils, whether they are round, equal, reactive to light, and accommodate. Doing that, you shine a pen light in the pupil and you can take a look, and you would be able to notice whether the eyes are reactive, they're round, and accommodate with each other. And you can do this on either side. The next thing I'd like to take a look at is the patient's ears. Are they symmetrical within each other? Are they proportionate? I would want to take a look on the external part of the ear. Do they have any bruises, any lesions, any dryness? Do they have piercing tattoos? You want to take a look on the external ear and then ask the patient if they use any hearing aids. Do they have issue with hearing? Do they use anything to clean their ears out? What kind of tools they may use? And then I can assess for hearing by using a tuning fork and holding it up to the patient's ear. I then would want to go and take a look at the patient's nose. I want to look at any deformities, if there is any. Is the septum form a straight line? Are they having an issue with patency, with breathing? Are they able to inhale and exhale through their nose? Is there any drainage, any redness below their nose? I would want to inspect the inside of their nose and their nares and see for any redness or drainage that they may be having, and discomfort they may be having as well. I then would want to take a look at their mouth and their throat. You would want to look inside their mouth and around their lips for any lesions, cracks, redness that they may have on the outside of their mouth. You want to look in their gums. A normal finding for their gums would be a pink. Is it moist? Is there any odor that you may smell? You want to take a look at the teeth. Are there any teeth missing? Is there a normal alignment with their teeth within each other? Are they not being able to bite down? Are they not able to swallow? You want to take a look at the back of their throat, their uvula, and see if it's a pendulum when they say ah. And then take a look at the posterior pharynx. Is there swelling, redness? Do they have any issues with swallowing? The next thing I'd like to do is take a look at the patient's upper extremities. I'd want to look at their hands and their joints and their wrists and their arms. Are they able to have good range of motion? I'd want to look and see where the swelling within their knuckles. Do they have any clubbing of their nails? You can take a look by holding them together. They could have that space between to see if they have the clubbing or no clubbing. You would want to document if they're able to supinate or pronate, abduct or adduct their arms. I'd have them push against my arms and pull against my arms to test for strength. Doing so, you would want to do it at the same time so you can test the equalness between each upper extremity. The next thing I'd like to do is listen to my patient's lung. I'd auscultate, starting at the anterior side of the lungs. It's important to start on the right side. You would start right above the clavicle, and you can listen to that bronchial sounds near the trachea. You would do the same thing on the left side. Listen to those bronchial sounds. You can move down to the second intercostal space where you can start to listen to the bronchiovesicular sounds, and then you can do it on the opposite side. You can start to listen for any crackles, wheezing, any issues within the lungs when they exhale and inhale. You would move down to that fourth intercostal space on both sides. Then you would move down to listen to that vesicular sound, breath sounds on that sixth intercostal space and the midclavicular line, which can be heard most audibly on the expiration. You would want to listen to the lateral sides of the lungs as well. On the left side, there's 3 points that you'd like to listen to. And then the right side, those 4 points you'd like to listen to. You would want to auscultate on the posterior side. There's 10 different spots that you'd like to listen to, starting on the left side. Above the scapula, you would start and move over from that point to the right side and down and over. You would follow the same pattern as you did on the front side to list to the posterior side of the lungs. The next portion I'd like to do is listen to the patient's heart. There's the 5 points that you would want to listen to, and then it'd be important to find the point of maximal impulse, which would be the apex of the heart, and listen for 60 seconds to find the apical heart rate. In doing so, you would start on the right side at the second intercostal space to listen to the aortic valve. Move over to the second intercostal space on the left side to listen to the pulmonic valve. Then you move down to the third intercostal space to listen to Erb's point. You can hear S1 and S2 at this point. Move down and you would want to listen to the tricuspid. And then you can go down to the mitral valve and you can listen to the for the apex of the heart and get the apical heart rate for 60 seconds. The next thing I'd like to do is listen, palpate, and inspect and auscultate the patient's GI tract. I'd like to ask the patient for their last time they voided, went to the bathroom, last time they had a bowel movement. Do they have any pain and discomfort after eating, going to the bathroom? I would want to auscultate first, and you would start in the right lower quadrant, move up to the right upper quadrant, left lower quadrant, and left upper quadrant to the left lower quadrant. Then I would palpate softly and gently to check for any tenderness, any masses, any pain and discomfort they may be feeling, any rigidity as well within their stomach. I then would like to test their lower extremities. In doing so, I'd want to take a look at their skin on their legs. I would check for a skin turgor on their calves. Is there elasticity? Does their skin go back after pulling on it? Look at their skin. Is there any bumps, bruises, any tattoos on their lower extremities as well? I would want to test for range of motions at their knees, their hips, and their feet. You would want to see, can the patient extend and retract? Can they dorsiflex, plantar flex, dorsiflex, point their toes away from me, pull them back? I would want to test for strength by having them press against me and pull against me using their feet. I'd also have them, I would press against their shin and have them press against it and see their strength there. I then want to test their popliteal arteries and behind their knee on both sides. It would be 2+. And then the dorsalis medialis on the foot on both sides would be 2+ as well. I would also be very important to test for capillary refills in the toes with that 2-second refill. The last thing you would want to make sure to check is the radial pulse and the brachial pulse. On either side, you would test it at the same time, and you would make sure that it's done at the same time on each wrist. And to get the radial pulse, and it would be a 2+ normal finding, and the brachial pulse on each side, and it would be a 2+ on each side as well. The last thing I'd like to do is ask my patient if they are comfortable, if they feel comfort at their home and in the hospital, they have someone there with them. I would want to make sure that the bed is at the lowest position, that the bed rails are up, and the patient has the call light near them, and ask if they have any questions, if there's anything that they may need. If they're satisfied and don't need anything at the time, I would perform hand hygiene and leave the room.